My name is Karen Vitale, and I'm the Program Manager for the Greater Rochester Practice-Based Research Network at the Clinical and Translational Science Institute. The Greater Rochester Practice-Based Research Network, or PBRN, is a network of primary care clinicians in the community who are open to working with researchers on research studies. So we are a network of about 100 practices in the Rochester area, and that reaches across health systems. So not just University of Rochester practices, but across the health systems, including Rochester Regional Health practices and federally qualified health clinics in the area. And we span across all primary care specialties. So pediatrics, family medicine, internal medicine, med-peds. Researchers will want to work in primary care for a couple of really good reasons. The first reason is that it's a more generalizable population. If you're at an academic medical research institution like ours and you wait until people receive care in the hospital, there are a number of people with a number of conditions that you're not going to run into if you're only recruiting in a hospital-based setting. The other reason researchers are interested in collaborating with primary care clinicians is that that's where most people get most of their care most of the time. So a lot of researchers in a lot of different disciplines can find the kind of research setting they're looking for in primary care. All kinds of research come through our network. Again, because that's where most patients get most of their care most of their time, and primary care clinicians are generalists. So not only do we see a lot of different sort of diseases and interest content areas from across the research spectrum, we also see lots of different methods of research. So when researchers approach us, what they can expect is that we're going to ask you questions about your study. And the questions are really from a practice's point of view. So what are you really asking the practice to do? What kind of time burden does this introduce to the clinical arena? And then we'll have you come in and meet with the co-directors of the Greater Rochester Practice-Based Research Network, and we'll kind of review your study and give you some tips and hints for maybe reducing the burden but having a successful project. So our services are available to any University of Rochester researchers. We encourage you to come to us earlier rather than later in the research life cycle, but we'll take you at any time. So what I mean by that is come to us even when you have an idea for a study before you've applied for funding, and we can help to sort of tweak your protocol so that it's most likely that primary care clinicians will collaborate with you. We also have a general idea of what the IRB is looking for, and we can consult with you at any point in the life stage of your study. What I'd really like researchers to know about collaborating with primary care clinicians is that it can be incredibly rewarding and really help the success of your project. The good news is that primary care clinicians in our area really do understand the value of research, and they like it for the potential to improve their patients' lives.